Today's procedure, we're addressing the crown in this gentleman. The crown area is more challenging in the creation of density for several reasons, including the size of the area, but also the growth of the hair follicles in this area. Hair tends to grow in a radial fashion and also flatter than it does in the front. So with light hitting the hairs in this direction, it tends to give less of an appearance of density. So the goals of this procedure are to maximize density with the number of grafts. And we do this by using the largest grafts, typically 3 hair follicle grafts, sometimes 4 hair follicle grafts. And if need be, we would place 2 grafts in one. So combining a 2 hair follicle graft with a 1 hair follicle graft to maximize the density with the least amount of recipient sites.